And thus we get to the part about fixing broken bones. Here we have a plate and screws, an internal fixation device for ensuring the bones consolidate in the right position. So essentially, during surgery, place the bones back in their correct place, and then you screw them down to make sure they remain in their correct place as they heal. Osteosynthesis includes realignment and stabilization. And finally, an example of joint replacement. So here we have a hip. You can see here the pelvis. You can see right here the iliac bone, the ischium, the iliac bone, the ischium, and here you have the femur coming to articulate there, and you can see that through the shaft of the femur they've placed the artificial joint. So when the hip joint is too worn out, you can try to replace it. So you essentially use the hollow region that's already present in the bone marrow canal, and replace the long metallic shaft. And at the edge you will have the edge of the prosthetic hip, which, like the normal hip, is a ball and socket joint, which can move in many different directions. This is, for example, the same that applies to our shoulders. That's why we have such a larger degree of movement in the shoulders than we have, for example, in the elbows, where we can't pretty much do much more than that. And that's why we have this specific type of artificial replacement. But don't take my word for it. We also have a shoulder joint here, as well as an elbow joint. So, on the right glenohumeral joint, a ball and socket joint. On the left, the radiohumeral, ulnohumeral and radio-ulnar joints coming together to form a trochogynglimoid joint. Or, in plain English, the elbow has a hinge component, flexion, extension, and a pivot component, pronation, supination. We can also see the interosseous membrane between the radius and the ulna, and this friendly hand and foot are here to remind us that there the joints follow a distal to proximal pattern. So roughly, hinge joints between the phalanges, condyloid joints in the metacarpophalangeal and metatarsophalangeal joints, and plane joints in the carpometacarpal and tarsometatarsal joints. But so far we've only seen the ball and socket joint replacement for the hip. You know where we can find another type of joint replacement? Well, we need only turn our attention to the main piece of the room. They wanted to make it really artistic, because to some degree it is an art installation, but this piece is largely dedicated to fixing bones, to artificial joints, and to fixation. So you can see, for example, her knee. She clearly has a knee prosthesis there, but I'm going to zoom in on it. You can see her artificial left knee, as well as a plate and screws for internal fixation of a distal tibial fracture on her right tibia. The tibia, by the way, is a really interesting bone being so superficial. You can see there are muscles around the tibia, but not covering it. But that's not all. A retractor reveals another fracture in the humerus and a fourth one in the radius, both on her left upper limb. So, did you fracture all these bones at the same time, in the same episode? Well, I don't know. It's a pity we don't have these people's medical history, but they don't share the medical cases in order not to allow identification. So, what was her situation exactly? Did she suffer a car accident, for example? Did she fall? But speaking of bones and fractures, that's not the room's only full body specimen. Here we have many large pieces. First we have, of course, the bones, and I believe, considering whom I'm talking to, it's completely unnecessary to go bone by bone, but you can see, of course,